Hey everyone, welcome back to another episode of Med Chat Monday Healthcare Specialty Series. Today we are going to learn about what it takes to become a dermatologist. Now, dermatology is one of the more competitive specialties in medicine. And to discuss this with us today is Dr. Brittany Oliver. So Dr. Oliver, welcome to the show.
Thank you so much for having me. Excited to share my experiences.
Well, we are very excited to have you on the show. So let's get started. Tell us a little bit about yourself and how you decided dermatology. Well, we'll get to that in a little, but tell us a little bit about yourself before we dive into the nitty-gritty about dermatology.
Sure. So I'm originally from Florida, actually. Kind of came from a medically oriented family. My father's a veterinarian. My mom is a nurse practitioner. So kind of grew up in that sciencey, taking care of others type of household. So I was pretty sure early on I wanted to be in some sort of medical field. Started out as a vet and then kind of eventually switched to wanting to do people medicine. And then I kind of been working my way up the East Coast through my training.
So when you got to medical school, did you know that dermatology was going to be the specialty that you ultimately were going to pursue, or were you very open to the gauntlet of what existed?
So it was definitely on my radar early on. In college, I shadowed a number of different specialists, kind of the bread and butter, like pediatrics, internal medicine. I was working in a neuroscience lab and shadowed neurosurgeons and neurologists. And then I kind of wanted to branch out and do something that I didn't hear people talking about a lot. So I did start shadowing a dermatologist in college. Loved it. So I came to medical school with it on my mind, but then you kind of open your mouth, say you're interested in derm, and people are like, wow, that's super competitive. And so I didn't know that until day one, I guess. And it kind of made me think twice about it. Like maybe I should consider other things if it's so hard, like everyone says. But in the end, after my third year clinical rotations, I still loved dermatology. And so I just went for it.
So what was it about that internship or that shadowing experience you had when you were in college that made you say, you know what, I'm going to really consider this strongly?
There was just so much variety just from patient to patient. I mean, dermatologists can see kids of all ages up to adults. And anything in between, really. And you never know what you're going to get when you walk into a room. So it could be a first-time patient with something as simple as like, you take one look at something and then within seconds you can come up with a diagnosis, or use the tools at your disposal right there, day one, to kind of make a diagnosis. Like if it's a fungal infection you're suspicious of, quick scrape, quick look under the microscope, you give them a diagnosis 2 seconds later and send them home with something that will fix the problem. Or you get those really, really complex patients who might have a lesion that you're concerned about, a cancer. And you can, again, use the tools at your disposal to do a biopsy, give them a call a week later, tell them what it is, and if needed, cut it out. So you kind of get a mix of, instant gratification when you can perform a surgery, fix a problem right away, remove a bothersome cyst or take out something that's malignant. And then you also get these really complex patients that you follow a long time that have diseases that cannot be cured, but just need to be managed. And so you have that opportunity to develop long-term relationships with patients too. So that's what I love. There's just so much variety.
Do you think you have to be a visual person to go into dermatology?
It certainly helps. A lot of what we do is pattern recognition, but that's also something that you can develop during residency if you don't feel like you come in with kind of that visual background, or if that's not the way you've always learned. I personally do think I'm a visual person. I am someone who in medical school watched a lot of videos online, a lot of video tutorials, video lectures. I went to all of my lectures, which not everyone does. Some people just stay at home and just listen on 2 times speed. But I needed to be there in the classroom, watching the lecture or give the lecture, taking my notes, and then looking at them over and over again once I got home. So I like to have something that I can see right in front of me. And so that was kind of another thing that, another pro in the dermatology column.
So take us through those first 2 years of medical school that are didactic.
Mm-hmm.
Did you get adequate exposure to dermatology in the classroom that, said, you know what, I'm still interested. I'm seeing these diseases up on the board, or in a lecture, and it's really interesting. Like, tell us what were those first 2 years like when you were in medical school?
Yeah, so unfortunately, I think there's, in many cases, very little exposure to dermatology in the preclinical years, even the clinical years, really. I remember at my medical school, I think dermatology got 1 week, and it was like a half block. So we actually split the exam with ophthalmology, so it didn't even get its own exam. And unless you already come in with an idea that you might be interested in it, you're not going to seek out those shadowing opportunities that can set you up for success later on. And it was not a required rotation. It was an elective. You could choose to spend 2 weeks in the dermatology clinic rotating through, but that again, it wouldn't really occur to you if you weren't looking for more exposure to it. At the same time, people are so mystified by rashes, so it seems like it deserves a little bit more time. But there was actually very little exposure. I had to kind of seek it out on my own.
So what recommendations would you give to someone, who's interested in dermatology? They come in as a first-year medical student. They're not going to get that much exposure in the classroom. What should they do?
So I think being proactive is really, really helpful. Dermatology is a small field, and the people who are choosing to stay in academia, they talk to other people who choose to stay in academia. And if you're at a program, if you're lucky enough to be at a medical school that has a dermatology program, I would say establish yourself as someone who's interested early on. Forget, that you haven't taken step one yet. Forget that you don't know how competitive your score is going to be. Just start exploring it, because you might actually get there and not like it as much as you thought. So I think, spending time in the clinics early on, identifying someone who you could possibly have a future mentor-mentee relationship with, who can gel with you in the clinic and then also outside of the clinic as a mentor, I think is also very helpful, because you want someone who's in your corner, who sees your wins as their wins, and is going to be willing to, when the time comes, to pick up the phone even and tell another program director, hey, I've worked with this person. Not only are they smart and look good on paper, but they're also very determined and reliable and, really come across well with patients, and someone who knows you both from the academic perspective and can see how you've interacted with patients and other residents and your fellow medical students. That's very important too, because it is such a small field. They also want people who can get along with others well. So I think identifying a mentor early on is very, very important.
Okay, so networking and finding a mentor are critically important, because it's a very small field. And more or less what you're stressing is that a lot of these program directors most likely know each other from these conferences.
Absolutely, yeah. And one thing that I did, and I had, not only did I have a faculty member who was a good mentor, I had another medical student who was a couple of years ahead of me who was also giving me advice. And I think that's also helpful too, to have someone who just went through the process giving you feedback, because they know the little nitty-gritty things about the interview trail, writing your resume or your CV, writing your personal statement, how to act during interviews. And then you have the academic faculty member who's actually going to, write your letter of recommendation, pull some strings for you, or kind of really go to bat for you. So that's very helpful as well.
So take us through now your third and fourth year. I'm assuming in your third year you didn't get that much clinical exposure to dermatology, unless you got introduced to some dermatological cases, maybe on an internal medicine rotation. What do you do to get your exposure in your third year, essentially?
So every medical school is different, but I don't remember exactly how it worked, but there was a way, either it was elective time or it might have been the general medicine rotation, where you could pick 2 weeks to do a subspecialty. And I obviously picked dermatology. And at that time, I hadn't fully committed to it yet. I was thinking maybe pediatrics is something that's exciting for me. I love kids. Pediatrics seems like the obvious choice. But I didn't let dermatology go just yet. So I scheduled a 2-week rotation, and it just kind of solidified what I already knew. And so I spent 2 weeks rotating in the clinics, and the program where I was at, the program was a little bit newer. They didn't have, a very robust consult service yet. So it was mostly clinic based rather than, seeing patients or seeing consults in the hospital, which is what I do a lot of now. So we were seeing patients coming for surgical appointments. So I would kind of be that first assist in like lipoma removals or cyst removals or skin cancer removals. Or what we also were able to do was in the resident clinic, we could see the patients on our own, step out, present to the resident first, and they would give us some tips and, good differentials so that we could shine in front of the attending. And then I would present to the attending, and then we'd all go see the patient together. So I learned a lot in those 2 weeks. Felt like I was definitely ready to set up another 4-week elective for next year. And it kind of, was the last little push that I needed to fully commit to it and realize that nothing else was ever going to satisfy me as much as doing this.
Now, when you were in medical school, did you do case reports?
Yeah, so that's a good question. I research, like you alluded to earlier, is pretty important in dermatology. It's a very research-heavy field. So one thing I did is I asked the residents if they had anything they needed help with. And then they could either say, yes, I have this paper you can help me with, or they would always give you some sort of information, some sort of direction to go into. And then they kind of pointed me in the direction of the program chair, who had a review that she wanted to write. So my first paper actually that I ever worked on was a review article. And it took many, many months. It's a lot of hard work. It's a lot of revisions. You have to be super patient because the first time you get that paper back, there might be red all over it and then you feel terrible. But then, you sit down, you do the revisions, and then you send it back. And this time there's fewer corrections or fewer critiques. And then eventually you'll get to the point where it's ready to submit. And so I did a case report. I did a review article. And then I actually decided halfway through my 3rd year that I was going to commit through dermatology. That's when I had finished my pediatrics rotation, had the derm rotation. But I felt like I didn't have enough research yet. So I did a research year at the NIH. And at that point I got a few other
so you took a year off after your 3rd year, and
I did.
Now, is it important to do research if you want to go into dermatology?
It is important, I would say. By no means does everyone have to take a whole year out. Personally, it was the right decision for me because I didn't feel like I had enough time to write anything substantial before the application cycle came around. But it is important. So it's a field where there are constant innovations and changes in technology, and we're learning more and more about diseases that have been very common and prevalent for years and years, and like underlying pathophysiology. And the goal is to have more targeted treatments, right? And so the field is moving in that direction. I mean, psoriasis is one good example. I think everyone sees the psoriasis commercials on TV, but it's such a common disease that cannot be cured, but it can be managed. And so it's a really good time to be researching, that, for example. And so they want people who are interested in contributing to the field long term and moving the field forward because it historically has been such a small field. With increasing interest, they were hoping that, I think the hope is that we'll kind of move in a different direction with some of these diseases that have been stagnant without treatments for so long. And again, another problem has been certain diseases are really debilitating, but we're not getting a lot of attention from researchers for whatever reason. Hidradenitis suppurativa is one example, but now there's a lot of interest in helping these people with this debilitating problem. So they want to gather people who are interested in making a difference long term.
So do you think most of the applicants now have, research in their CV or have committed to case reports? Like that seems like it's a criteria to get into dermatology because it's so competitive. I don't know of a single person who hasn't done some form of research, and it does not even necessarily have to be dermatology related. So for people who change their minds really late in the game and decide that they're interested in derm at the very end of their 3rd year and need to scramble to put something together, at least if you've shown interest in research and medical research and moving medicine forward in your 1st, 2nd, and 3rd years, that still shows them that you want to move medicine forward. So it helps if it's related to dermatology, of course, but I think just having that on your CV as a background interest kind of demonstrates that when you say you're interested in research, you're being sincere and you're not just checking a box on an application. Now, would you recommend to medical students who are interested in dermatology, they have good grades, they don't necessarily they might have committed, they might have written case reports, would you say take that year off after your third year, do a similar research year as you did?
It's really up to the individual. I would say, I mean, this is so hard case by case basis. It's like, if you really love research, take a year off. If you genuinely are passionate about research and want to develop your skills as a physician scientist more, then taking a research year would probably be critical if it's something you plan on doing in the future. If you feel like you need a break from the stress of medical school, a research year is another great thing to do. If you feel like you have a hole in your application and you didn't do any research in any field in your first 3 years of medical school, then it's a good idea. Or if you feel like, I have a lot of strengths on my application and I have a few weaknesses on my application, that's one easy thing you can do to kind of make up for a perceived, kind of hole in your CV. So there are a lot of reasons to do a research year, and it's different for everyone. And some people really, really love research and want to build a career out of it. And then it's certainly a good idea. And some people just need a break from medical school.
In terms of your application, though, it's going to make your application certainly more competitive.
I think so. And I think it also depends on the type of institution you see yourself at. Because there are, 115, 120 dermatology programs out there. Not all of them are going to be looking for the same thing in an applicant. Some institutions value research much more than others. And so if you are someone who just wants to match because it's so competitive, then, and you don't necessarily want to be at a very research focused institution, then it's not as critical. I'm still going to say that research is critical, no matter where you want to go. But as far as taking the year out, some programs look much more highly and favorably on that than others. It's just not a priority for everyone.
So you finish up your research year, you go back to medical school, you start your fourth year. Could you take us through what your fourth year was like? I'm assuming you did away rotations.
Yeah. So that's another thing that's very helpful, is to spend time at other institutions, not just to see how things are done elsewhere, but also to kind of get your name out there, your face out there, put a personality to the CV that you've sent to the institution. So I did another rotation at my home institution just to refresh their memory. I mean, they had pretty much gotten to know me at that point since I was spending time with them since my third year. But I also set up 3 additional away rotations. So that took up all of my fourth year elective time, but it was worth it to me. And I made myself geographically available. So I did my away rotations in different regions and planned it so that I could potentially get a letter of recommendation at each of these institutions that I could send strategically when it came time to submit my application. Because if people who haven't, reached this stage yet don't know, is that you can upload almost as many letters of recommendation as you want, and you can decide where to send them to. So if I want to open up, the Midwest, I did a rotation in the Midwest, sent that letter of recommendation that I got to all of the programs in the Midwest, and that kind of shows them, hey, even though she spent most of her life on the East Coast,
she's willing to
maybe
come
make a big change.
Yes, I see that.
Yeah, exactly.
And that's important to give a first year medical student that perspective, that you kind of have to be a little aggressive and strategic in terms of how you're thinking about applying when you get to the end of the road of medical school for residency.
Right. And these are the things that I found out from the medical student who had successfully matched 1 or 2 years ahead of me. So this is not something that I was going to get from, a faculty member who was,
But you will get it on MedChat Monday now.
Exactly. Yeah. So you guys are in for a surprise, because this is a very, very important tip that I got.
Okay, that's great. So now you apply. You went to all these sites. Was that valuable by spreading your wings and going to different geographical locations in the United States? Did that open the door at certain institutions that might have been closed?
I think it did. And I mean, I think probably a lot of things helped me as far as, number of interviews. They always say there's a certain number you should reach in order to feel safe that you will match. But I think some things that opened the door is that my mentor believed in me. I showed up when I was supposed to. I made the deadlines that I was supposed to. And then so I think he already had my back. And then just by getting a few letters of recommendation from, parts of the country that I had never spent any time in, I was able to strategically send those and then, there were a few interviews I got where I was like, I'm not sure if I would have gotten that interview if I hadn't, spent some time in the Midwest or on the West Coast, because it's competitive everywhere, especially on the West Coast as well. So I do think it was beneficial from that perspective, in opening up programs that might not have looked twice in my application, because they want to interview people who will actually come there. And if they don't, you could have the best application, the best step 1 score, best step 2 score. And if they have no indication that you would ever leave, maybe the town or the state that you grew up in, went to medical school and went to college in, then they might put your application aside because they want to interview people that are actually going to consider them.
Of course.
So I do think that was a big part of it as well.
Okay, so take us through. So now you are a second-year resident. You're a first-year resident for dermatology. You've completed your intern year. You're finally a dermatologist. Congratulations.
Thank you.
How has your first year been?
It's been a lot of fun. So it's a pretty steep learning curve when you start, right? Because I just said we get like a week of dermatology in medical school. In the preclinical years. And then you kind of decide how much time you're going to spend extra in it in the clinical years. I had maybe 3 weeks of derm elective in my intern year, which was nice. Not everyone gets that. But you come in after a year of doing internal medicine and you know nothing. Everything you did learn, you've forgotten. But my program was really great about reassuring us that, hey, we expect you to be at kind of this baseline of, we are going to put the knowledge in your heads. We don't expect you to have a lot of it there already. So we kind of jumped right in. It's structured so that we spend a lot of time in attending clinics. We have our own resident clinic. We run consult services. We spend time at the Children's Hospital and at the VA as well. So it's a lot of different practice settings that we're exposed to. It's very busy. But we also make time for didactics. So we have 2 half days a week where it's totally dedicated to teaching. So we get lectures from mostly faculty members who are experts in their own, field of interest, whatever subfield it is. And then at the very beginning, when we need to learn the basics, some of the upper level residents are the ones that teach us. But mostly where I'm at, it's faculty-led didactics. And so there's that piece of it. And then there's the in-person hands-on clinic aspect of it.
How many years is the residency?
So to become a dermatologist, it's 4 years total. So you have that 1 year of internship, which can be in medicine, pediatrics, or general surgery. And then after that, it's 3 years of dermatology, and then you're done. Unless you want to do a fellowship.
Okay. And are there any are you on call? Do you have late nights? Do you have to work weekends? What's the usual schedule as a dermatology resident? If you're doing general surgery, you're waking up at 4 in the morning. You don't leave till 8 o'clock. You're working 6 days a week. Could you give us a little perspective of, what does a typical week look like?
Yeah. So that also might be variable program to program. So we're I would say probably a larger than average dermatology program. And so we are able to split the work among more people. But there are lighter rotations and more demanding rotations. So I would say if you're on a consult service, it's a little bit more demanding. So you hold a pager or a call phone. You get calls throughout the day starting at 8 a.m. from inpatient teams who need a dermatologist's opinion or need someone to come look at something. And you can get anywhere from no consults in a day to 10 consults in a day. And so that kind of drives how busy you are. And then, as first years, we do take call. So the nice thing is that it's a first year job. And then when you're a second year and a third year, you can kind of wash your hands of call for the rest of forever, if that's what you desire. But we cover 5 different hospitals, when we're on call. And on top of that, we also cover outpatient phone calls. So if there's a patient who was seen earlier that week or, ran out of their medication or has some sort of question, then they are also able to reach us 24/7.
Okay, so are you doing late night calls? Are you working on the weekends?
Yeah, so again, that work is divided among myself and my co-residents. So probably every 5 to 6 weeks would be your turn to be on call. And so that includes Friday night to Monday morning. So you would plan to round on Saturday and Sunday, just like you would a normal work day. So you're kind of fielding new consults that come in, seeing old patients that might be acute or need more attention. And so that's probably every 5 to 6 weeks. And then we also take weekday call. So from 5 p.m. to 8 p.m. the next day, if it's your turn to be the weeknight person, you're taking phone calls, and they can come in at any hour. They really can.
But it sounds like call is a little lighter than doing general surgery.
It's lighter than general surgery, I'm sure. I'm not going to take that away from general surgeons. But I've gotten 3 a.m. phone calls for Stevens-Johnson syndrome rule out, and you got to go in for that. There are not too many derm emergencies, but that's a big one.
Okay, so when you're in your residency, how important is it to do research? Because I'm assuming that there's an option to do a fellowship or fellowships post-residency.
Yeah. So again, that depends a little bit on your institution and how much emphasis they put on it. But if you are interested in it, then you can do it. Whether you identify something that you're passionate about that you want to pursue, or you kind of hop on board a project that's already in progress. There's a lot of time in residency to kind of develop your interest. And I'm coming in and I am just figuring that out. So I haven't done too many projects so far this year, but it's about, taking on what you can actually handle, because you're balancing call, you're balancing a personal life, you're balancing kind of just learning dermatology and the basics. So you kind of have to decide how many research projects you want to get involved in early on. I think 1 or 2 is totally reasonable to focus on. It does help if you're someone who wants to stay in academics or wants to have a lab one day or wants to establish yourself in the field as an expert on something. You're going to want to have a niche and publish a lot. And again, finding that mentor this time at the residency level will be really important too. But that's kind of up to you. Not everyone has the same interest in research once they get to residency. And so I think it's a time to really identify your own personal interests. And then the opportunities will come, it'll be born out of a genuine interest in a certain disease or problem that you've identified. So that's kind of what I think is just the natural progression that happens to most people in residency.
Dr. Oliver, when you get to the end of your residency, what are the options? Do you start practicing? Do you do inpatient, outpatient, or are there fellowships that one can consider?
Yeah, so, that's the nice thing about derm. There are so many different practice models and styles. So, inpatient dermatology is kind of seeing a resurgence. So we have a very strong medical dermatology interest at my program. And so we tend to attract people who are interested in med derm or interested in hospital dermatology. There are complex medical dermatology fellowships out there. The kind of more recognized fellowships would be dermatopathology, pediatric dermatology, and Mohs surgery. And then there are also other things like cosmetic surgery or laser surgery types of fellowships. So you can keep going in your training if you want to, or you can just be a general dermatologist and go straight into practice either in academics or private practice, or there's even hybrid models as well. A lot of universities are, looking for attendings who are interested in seeing consults at the hospital. So that's available if you're interested too.
Do you see an equal amount of women and men in the field?
So dermatology is a field where I would say, as far as numbers go, that's been something that's been more balanced probably than other fields. So there are a lot of women in dermatology, and I don't think that's changing anytime soon. What has been a problem in the field in the past is kind of the racial ethnic diversity. And that's been historically lacking, but is definitely changing in the right direction now. Like
there's not enough African Americans or Asians who are in dermatology? Is that essentially what you're emphasizing?
Yeah. And, the question is, why is that? Is it because people aren't exposed to dermatology early enough? It's not one of the core rotations, or when you think of medicine, you don't think of, wow, I want to be a skin doctor when I grow up. You think about surgery, you think about pediatrics, you think about medicine, you think about OB. And dermatology is just not on a lot of people's radar. And so that was one question, are we not attracting, enough people because we're just not getting to them early enough? Or is there something about dermatology where the perception is it's, not accessible to certain racial ethnic groups? But that's also not true. We see my clinic is extremely diverse. And so I think the provider population should reflect the patient population. And that's something that has been recognized by the American Academy of Dermatology. And a lot of people are making strides towards changing that and trying to recruit people earlier on with diverse backgrounds. So that's a very positive change.
And that's one of the things we're doing today. So
exactly.
What would you say to a medical student? How would you inspire them to go into dermatology?
So I would say if you're coming into medical school with an open mind, go off the beaten track a little bit and explore some fields that you don't hear about as much, and if dermatology is one of them, just be open, try and spend some time in the field, and being proactive is something that served me really well and that not everyone does or is capable of doing. And if you're not someone who's usually proactive, but you want to go for something that's a little bit more competitive, you just got to find that inside of you. And if it's truly your passion, you will go for it. And I think the rewards of pursuing what you're truly passionate about and believe in, you throw away any of the doubt that might be there, which is what I did. You kind of come into something like derm and hear people talking about how hard it is. And you just have to say, it's what I want to do. I'm willing to not match the first time and apply again and go for it again. Like, it doesn't matter how many times I fail, I would reapply. And if that's kind of your mindset, then you know that it's the right field for you. You're willing to do so much. You're willing to watch your friends graduate while you stay and do a research year. So I'd say don't be afraid to go off of the beaten path.
And you're right. Not everyone matches right into dermatology, but if you're persistent and you really put your foot on the ground and you put in the time, you eventually will get what you want. So
I truly believe that.
Thank you, Dr. Oliver, for your time. This was really a very important interview because you gave us a framework for how one would pursue a career in dermatology. So I really appreciate the time and energy that you brought to this interview. It's really going to inspire future dermatologists.
I hope so. Can you tell that I'm actually very passionate about this?
Yes, I can. We can all see that. Thank you.
Good. Thank you so much for having me.